Okay, thank you. So good afternoon, everyone. Thank you so much for inviting me to speak at your annual meeting today. And I do see a non-blurry version of a lot of tables on my screen now. And dots of people. So I know you all are there. So thank you for having me. Um, I'm Livleen Gill. I'm the immediate past president of the Academy of Nutrition and Dietetics, a current board member, and I'm very excited to be here. And I'm sorry I couldn't be there in person, but Iowa, I have been actually, that is one state I have been to, and Des Moines a few times. And if Ashley Danielson is there, she was the one who invited me before.
Yes,
So
she is here.
okay, and I am excited to be virtually here. So today, I am going to talk a little bit about our academy. As you know, as some of you may know, some of you may not, so it's a refresher. The academy was founded by a visionary group of leaders more than 100 years ago who recognized the power of food and nutrition and its impact on human health. And we are so lucky that this is the time when everybody is talking about nutrition and how nutrition really is the building blocks of good health. And our leaders were very visionary. And that inspiration is reflected today in our vision, a world where all people thrive through the transformative power of food and nutrition. And to achieve that vision, our mission is to accelerate improvements in global health and well-being through food and nutrition. Our academy is the largest organization of nutrition and dietetics professionals, representing more than 115,000 credentialed practitioners. Of those, there are more than 4,000 board-certified specialists, and there are more than 14,000 nutrition and dietetic students enrolled in programs across the country and the world. And yes, I mean the world, because Ghana is one of those countries. So let me revisit the academy structure, because there's a lot of questions and confusion among RDs and our members. What is the academy, right? And what's the governance structure of the academy? So let me start by saying the academy enterprise, because that's a way better way to use it. It refers to the entities of the academies of nutrition and dietetics. And there are three separate legal entities. The Academy Foundation is a 501c3 organization, so hence it's separate. The Academy's Political Action Committee, ANPAC as it's called, is set up as a 527 group, and which has segregated funds. And then the Academy member side, the Accreditation Council, and the Commission on Dietetic Registration, they are part of the 501c6. And you, the affiliate, are a completely separate legal entity. So I just want to make sure that everybody knows that when you're talking about ASCEND, CDR, the Academy, it is one. We are a one family. Now, before we look towards the future and our 5-year strategic plan, which I had the privilege as president last year to get to everybody in April of this year, I want to remind a little bit how we got started. So as we all know, COVID changed a lot of things. We as the Academy also had to step back and reassess our strategic priorities. The world around us had shifted, and we knew it was time we needed to adjust. The Academy was doing a lot of things, but there was a need to take stock and identify the strategies and priorities that would strengthen the Academy and the profession going forward. For this, at the board level, we had many thoughtful, engaging conversation and exploring the state of our profession. So from that the analysis that we did, three key trends emerged. First, that the value of the dietitian is poorly understood and that dietitians feel undervalued, under-recognized, and underpaid. And those of you who are in that room, you say, okay, we already know that. Yes, we've been saying that for a long time. Nothing new here, right? I get it. But we had to recognize that. Second, that the Academy can better meet today's needs of its member by aligning some of the resources. And third, that a diminished sense of belonging means individuals feel disconnected from our professional community. So if you can see, we have theme 1, perception of dietitian, theme 2, membership value, and theme 3, culture and belonging. So then we took all that, and what I unraveled in April, the strategic plan, and I'm not going to bore you with too much, but I just wanted to say the main themes for the next 5 years, the blueprint. First is the defined identity. Second is partners and communities. Third is shift in culture. The fourth, professional empowerment. And the last one is operational excellence. So these priorities were all built to support and empower you in meaningful and lasting ways, creating a clear path for growth and visibility and to support our brand, practice, research, policy and advocacy, and technology. Operational excellence is very important because without that being a pillar there, we cannot be above and beyond and be creative and be ahead in our profession. So you all know that there was a strategic plan before. And so what changed? What do we need to do differently? How are we going to make sure that this time, remember, it is dynamic. Things may change. Our environment may change. It may have to shift. But one thing that sets this plan apart is our focus on consistently measuring progress. As dietitians, we know we talk about outcomes. We talk about measurement, right? If we don't measure, then how would we know we are succeeding? So that is a key thing of our new strategic plan. And by tracking key performance indicators, we'll always know where we stand and what needs to happen next. Every strategic priority will include operational plans to ensure the right resources are available so that they may execute well. And a lot can change in 5 years, so we have built-in opportunities to annually review and adjust. With every step forward, we will move closer to that shared vision. It is not a one and done thing. It's a long-term journey. As you know, if you're in clinical or you are in any committee or anything, remember we do plan, do, PDSA, plan, do, share, act. Well, it's kind of similar. Continuity is going to be the key to the success of this plan. This plan stands out because it gives the board and the Academy leadership a focused set of priorities to move forward. It ensures continuity, a common thread helping us stay on course, and it creates a shared framework that guides decisions and drives long-term impact. So this also will show for us, for the board and the leadership to come to members and show and be able to track progress and share that with our membership. So you can see how, whether we are making progress or we are not, or we need to tweak something. So now I'd like to discuss some of our current initiatives the Academy has been working on to help advance our mission. And I know you all are interested in this. So as you know, we are in an ever-changing dynamic environment these days. I don't know if you recall, but on July 4th, the reconciliation bill was signed into law, enacting significant cuts to critical nutrition programs, services, and research that decades of evidence show are effective. These cuts impact essential programs like school meals, SNAP-Ed, and other nutrition interventions. Currently, there is no indication of new investments or initiatives to replace what was lost. So the Academy mobilized before this bill was even signed into law and got organizations to help support and urge Congress to protect investments in nutrition security. And these are the list of organizations on the slide that you see that we partnered with. Now, in addition to a letter that we sent then, we called on anyone who cares about protecting these programs to make their voice heard before the decisions were codified. I'm not sure how many of you did, but saw these, but the Academy did roll out resources to how to contact Congress, the action alerts, the social media toolkit that was provided, and there was a dedicated landing page to empower members, partners, and the public to speak out. And it was amazing the way the communities responded with strength and unity. More than 35,000 action alerts were sent to Congress, and we generated over 5,000 social media engagements urging protection for nutrition and food security programs. So the next one, to show you progress on the Dietitian Licensure Compact, and I know that you in Iowa are very familiar with that because you are one of the 13 states on this slide. Yay, Iowa. And here I'm in Maryland. We haven't even started, so you are way ahead. The compact, as you know, improves licensure mobility, particularly for RDNs in military families, while reducing administrative burdens, improving public protection, and supporting workforce development. Now that the required number of states have enacted the compact, the process for the Compact Commission is underway. They had training back in the summer, and their first meeting is going to be next week. So Iowa, because you are one of those 13 states, you are going to have a hand in shaping this compact commission. So thank you for that. Oh my God, let's talk about some misinformation. I know that you all know that misinformation about nutrition is widespread, and it's more important than ever to rely on science and evidence-based expertise. And the Academy is committed to taking on uncredentialed and unqualified individuals giving nutrition advice by opening more doors to Academy members to be heard by decision makers and consumers. We are proud to amplify the voices of our community and help ensure that evidence-based nutrition and health science shapes public health, policy debates, media narratives, and consumer choices. This page that you see is constantly being updated so it can provide information that is trustworthy, evidence-based, and that you all can rely on and the public can rely on. The Academy has your back. So one of the really cool things that's happened is we've made big strides this year to listen and engage more with our members. And so, well, what did we do? We rolled out on June 1st a new member benefit, free live webinars, giving members more opportunities to learn, grow, and earn CPEs. A new member feedback tool was launched, and that goes directly to members for quick questions and pulse surveys. And we've received more than 22,000 responses from these. And these real-time insights are helping guide our decision. We also did a new engagement tool, which was, getting people piloting the DPGs to see if the members or non-members, we would give a free DPG enrollment so they could see what member benefits that there are. And that is enough of me talking. And I am here to take questions because I know you all have a lot of questions for me. I'm hoping I can answer them. Let me stop this screen share.
Thank you so much, Livleen. Does anybody have any questions?
Here I am.
Can you hear me okay, Livleen?
I can, yes.
Okay. We have our first question.
I was just wondering if you could go into a little bit more detail on the compact bill, as far as those 13 states that are past it. Does that mean that we need I guess what does it all encompass? So I know that won't have to get licensure in all those different states, but do we get licensure in all those different states within? That question makes sense. Just explain it a little bit more.
Okay, so what the compact is, so Iowa is part of the compact because you have the law that was passed. Now, the Compact Commission is going to make the rules because you had to have 7 states pass this legislation before the Compact Commission could be set, right? So now that it's going to be, they're going to do the policies and procedures. But what it allows dietitians to do is practice across state line. If your state is one of the states that is part of the compact, you would have applied to the Compact Commission to be able to practice, pay a fee, and be able to practice in all those states. That's really what the point of it is. And if a state is not as part of the Compact Commission, like let's say my state is not right now, we would not have the ability to be part of the compact or be able to practice across state lines through the Compact Commission. We would have to individually pay for each state to become licensed to then be able to provide MNT or services across state lines. Does that help clarify your question?
Yeah, so just to clarify, so that if we apply for a compact license, we will be licensed in all 13 of those states that passed it?
That's correct. So you will apply to the Compact Commission for that license. So you have to still have a license in your primary state that you reside.
Does that help? Okay. Any other questions? None? Oh, never mind. We got one.
Could you kind of summarize some of your roles and responsibilities as past president of the Academy? So what's current president doing? Just kind of summarize what the different roles and responsibilities are.
Sure. So my current responsibilities as past president are the past president sits on the Academy's nominating committee. The past president is chair of the Policy and Payment Committee of the Academy. The past president is also on the governance committee of the Academy. And let me see, what else do I do? Also on the compensation committee of the Academy. And in addition, the role is also to be a spokesperson for the Academy, as I'm doing now, to talk about the Academy or in other venues that the Academy representation is there.
And then if you could distinguish between like the current president and there's a president-elect, right? At the national level?
Yes. Yes. So the current president is basically the chair of the board of directors and is the head of the Academy of Nutrition and Dietetics. Is the main spokesperson for the Academy, represents the Academy on policy or events that the president is required, and really and speaks regularly with the CEO of the Academy and translating that information to the board, is literally responsible for, I would say, everything. Yes, the CEO is the operational head, but the president is responsible for the organization as a whole, if that makes sense. So the president-elect sits on the Finance and Audit Committee of the Academy. The president-elect also sits on the Compensation Committee of the Academy, is on the Policy and Payment Committee. And if the president cannot fulfill a role or something, then the president-elect by our bylaws is the one who steps into that role. So those are kind of the main, and it's probably similar to what you all have as the affiliate, except that in the affiliate, because it's so volunteer driven, you don't have what at the Academy we have the CEO and staff with that whole operation, where CEO is the head of the operations. And the president is the head of the organization and chair of the board of directors.
Yes, my question is, we have seen a decrease in our Iowa Academy members. Are you seeing that nationally, or is that more our state? And what suggestions would you have on how we could, I guess, help people see the benefits of membership?
So, great question. So, membership in the Academy has been declining since 2016. Slowly it was, but COVID kind of really accelerated that. We had a lot of people who retired. We also had where, the whole transition of going into the future graduate program. And also we had people who left the Academy for reasons, they didn't feel that they were getting the value. So Iowa is not alone. That is across the board. But what I am going to tell you, this year, we're starting to see a change. The loss of members is less. We've been able to regain members this year. So I'm hoping with the changes that we have initiated last year, we're going to start to move forward and people will see the value. At this fancy that we recently had, we had a lot of people who joined who are non-members. I wouldn't say for the first time, but who came back into. So we are seeing a change. Now, what I would say, affiliates are our grassroots. So how can we at the Academy help the affiliates in, if you want resources, when we are talking about value for members, how can you plug into that? That would be something that the Academy can help. And as you see on social media, we have made a big change. We are more there. And I think hopefully the young members, young individuals are seeing that and coming around. So you're going to hear of more. We're doing a lot more to engage individuals to come in. So this was the first step, stopping that outflow that we were having. So I'm positive that we will see a slow increase.
Thank you. More?
You had a nice slide that kind of demonstrated the different areas with the academy, where you had Ascend, CDR, and the academy, and then you had the foundation and then the advocacy group. I think it'd be good for some of the members and non-members here to understand how your membership dollars go for those various organizations and what it can and cannot do, because I think a lot of people leave the academy because it hasn't done enough for me. And I think having that understanding of what those various entities do and what they can't do might help some people here better understand the value of their membership.
Sure. So I think that's a great question. The membership dollars are not shared with the foundation. It doesn't pay for the foundation, nor does it pay for ANPAC, completely separate. What your membership dollars pay for are the middle part, the academy. So when you saw that slide of mine, it showed you the 501c6. That's what it pays for. The CDR is the credentialing arm of the academy, and there's a firewall between CDR and the academy in terms of that they do the writing of the exam, all of that, where the credentialing part of the association comes. Ascend is where they accredit the education programs. None of the academy membership dollars are shared over there. The one thing that we did do is your membership dollars pay for advocacy. What you're seeing about the Compact Commission, what we have the lobbyists in, which I didn't say, but we have a lobbying firm in DC now. We have staff in DC working on policy issues and reimbursement. All of that is where your dollars go. And as you know, if you have lobbyists, a significant amount of changes that we want to do is at the policy and advocacy level where we have to support it. And I understand the frustration that dietitians have had over time that we are not able to get more reimbursement. We're not able to bill. But we have now that is a lot of where your member dollars are put into. Second is the resources that you get from the academy, all the evidence-based research that's being done or being partnered with. All of that is part of what you have availability to get for your membership. From the seat that I sit, and I'm going to take off my hat as immediate past president of the academy, or even as a board member, as a dietitian in private practice, that reimbursement to me is key in order for us to be able to provide access to individuals and be able to make those changes and show what our profession is about and be the real linchpin in that healthcare community and the community outside of healthcare. So that's kind of where the academy membership dollars are really going. And if you know, the part of the membership dollars that we get also goes to the affiliate. So we don't get, and let me be very clear about where one of the things that I hear about is sponsorship. Having been past treasurer of the academy and past president now, I could tell you less than 3% of our dollars come from sponsorships. We do not get money from sponsorship. That is something that you can say loud and clear that we don't get those dollars. And so we should be comfortable. And all of the things that you see on social media or something, that is all old news, regurgitated information that is being put. It is not true. And unequivocally, I can sit here and be honest with you and say that is not true. So you can tell colleagues and remember, whoever talks about that, we get money from Pepsi and Coke and all of these. No, it is not true.
Thank you, Livleen. Everyone's clapping for that. Yes.
But we do need our membership dollars to keep doing what we need to do. So
Absolutely. We've been stressing that here at the affiliate as well.
yeah, we do. And you know what? You have a right, as affiliate, your president, your elected board members, even you as members, you have a say. You have a say in what the academy is doing. And participate in those surveys that you get. I know we are inundated by surveys, but I'm telling you, if you want to get your voice heard, those 5 questions will not take you too long. Answer them because your voice is important for where we are headed.
Thank you, Livleen. We have also an affiliate membership survey we've been pushing as well because we keep telling them that they need to fill this out in order for their voice to be heard. So also at the national level, please fill out those surveys. Any other questions? All right. Well, thank you so much, Livleen. We appreciate your time today and all of your information. And
Thank you. Thank you.
Thank you.
Thank you so much for having me and enjoy the rest of your conference. Take care. Bye-bye.